Mike McCool here in the Royal Examiner studio, and with me today is Steven Quackenbush. Steven is the executive director at the Front Royal Treatment Center, which is part of the Pinnacle Treatment Centers. You guys are all over the country, aren't they?
Yes.
It's a pretty well national organization.
Yes.
So they have moved into the location. If anyone knows where Noah's Ark was, everybody knows where that was.
Yeah, we get that quite a lot.
Where are you? Well, I know where you're at.
That's right.
Yeah. And so they have finally opened. You've opened kind of a soft opening. You've been open for a month or so. And so we want to kind of, introduce you to the treatment center. I know it's been one of those things that people have been waiting for a long time to get another one kind of opened up here. So talk a little bit about our drug problem that we have and what you have done to help it.
Yeah, so I don't think anybody's surprised by the fact that the opioid crisis is still going on. And so, Virginia alone saw in 2021 over 2,000 overdose deaths, and 76% of those were attributed to fentanyl. So it's definitely here. And so what our goal is to do is to use every tool in our toolkit to combat that. So we are an outpatient treatment service for persons with opioid use disorder. Mm-hmm. And we provide medication-assisted treatment through methadone and buprenorphine, which people know by Suboxone.
Sure.
And we couple that with counseling services and case management services. So I always say that the medication is a small part of what we do. The big part's going to be the counseling and the case management. And so we utilize every tool that we have to help people in their recovery from a horrible drug and a horrible crisis.
Yeah, people, once you get hooked on drugs like that, it's hard. Well, and the state has cracked down on doctors prescribing, and I think all that it kind of does is push people to street drugs.
Right.
And then next thing you know, we have overdoses and things, because who knows? You always watch on TV, they're cutting all this stuff with rat poison and doing, who knows what they're doing. And yet people will take it knowing that they don't know what it is.
Yeah, and you brought up a good point too. And I think something that perpetuates stigma is people say, they have a choice. They can stop using this certain drug if they want to. But addiction is a progressive disease. And so once you've reached a certain point of dependency, you can never go back. You will always be dependent on that certain drug or whatever that addiction is. I've heard it said that once you're a pickle, you'll always be a pickle. You can't go back to being a cucumber. Yeah.
That's right. Exactly.
And so the patients that we encounter are in that progressive dependency state. And so we come along to help them maintain through a safe medication rather than using illicit opioids off the street.
But do you ever reach a time where they wean off this drug? Can they do that?
Right. So when patient comes in, immediately they get placed with the treatment team, our doctor, counseling staff, clinical supervision, to assess a treatment plan for that patient. Some patients, yes, they may reach a point where
depends how long they've been on something.
Yeah, they may reach a point where they say, okay, I'm ready to start decreasing this medication because I want to live a life that has no medication or substance in it at all. But then you have some people that it may be something, if this is what works to maintain them, then obviously we want to provide that for as long as they need it. So really it's a patient choice, patient voice type deal, along with the direction of our medical director and counseling staff.
Right. So I mentioned to you before we started, that we've had associated with people that have been on this treatment, and you'd never know it. They were fully functional. They just look like everybody else. So it's something that works, and people can get back to a normal life even though they are medicated. It seems like we're medicated for everything.
Right. Yeah.
We want a pill or a drug to help us whatever it copes with. But I was looking at your website and I noticed that, like you mentioned, the drugs are just a small part.
Correct.
I would call it more of a holistic approach.
It is, yeah.
And you take and you make sure that they're going through the counseling. So if people aren't doing the other steps, they don't get the first step. Then is that correct?
Yeah. So it's all inclusive. So you have to participate in the counseling services to get the medication services and vice versa.
So you just don't stand in line, take your drug, and out the door you
Correct.
go.
Yeah. And when patients come in, we are very transparent about that. Like, this is part of the treatment process and what we have to do. And you're right, it is a holistic. We treat the whole person.
Right.
So we're not only just looking at, okay, what dependency do you have, but what are some of the other social factors in your life that we can work on to get you to a point where normalcy, or what's normal for them, or stability.
Yeah, because people get on drugs for a range of reasons.
Correct.
I mean, I'm sure there's not any one thing.
Yeah, and addiction does not discriminate.
No, it's all across the board, from poor to rich, to white to black. It doesn't matter, does it? It doesn't matter. So, what's how many people can you treat there? I mean, is it unlimited or?
Yeah, so we currently try and keep a 50-to-1 ratio for counseling, but that doesn't.
But I mean, you can't grow, right?
Right, correct. And
it's a big building.
There's very little barriers for someone to coming in and to receive treatment. And because we have facilities all across Virginia that offer the same level of care. There's potential that we can do telehealth. COVID really expanded the services that we can provide through telehealth, and so those are always options as well for people that want to access treatment.
I notice your organization offers like an in-treatment center, not here, but in other places around the country. Yeah,
Pinnacle has a full continuum of care, so all the way from residential detoxification to intensive outpatient services, and we're one of the lower levels of care. But we do have that network, and so if we identify someone that may need a higher level of care, we can refer within our network, or something that may be relatively close to the patient, and then we're always there as a step-down program for them to come back to.
Well, let's touch real quick. We hear that word opioid thrown out, but I'm looking at all the list of things. Opioid is a lot of drugs,
right? Yeah,
things that we hear on the fentanyl and heroin, and there's all these things are all derivative of these. Is that correct?
Yeah. So you have your standard opioid medication that initially started this whole crisis that was being prescribed for pain, and OxyContin and oxycodone, and then you have the heroin and the fentanyl, the more illicit or illegal street drugs. And of course, right now, fentanyl is the prevailing one.
That seems to be because such a little bit goes a long way.
Correct. Yeah. And so and that's what we're trying to battle right now. And I know there's work on the state level and the federal level to decrease the amount that's prevalent in our communities, but we're also here to help provide for people that are already addicted to that.
So now people have to want to get off this drug. Are these court mandated, or are these personal choices, or how do people become and use your service?
So yes, so we all
of the above.
Yeah. So we base that on a motivation to change scale.
Okay.
And so you do have some that come in that have those outside factors that are having them be there. So it's court mandated, like you said, or social services, or they're self-motivated and they want to get into treatment, or they just wake up one morning and realize what they're doing right now is not what's working, and so they're going to try and to get into treatment.
They always say that you have to want to change.
Yeah.
And some people do. I mean, it's like anything. You wake up one day and said, enough is enough. And you finally realize.
Yeah. And we have trained staff for the full continuum of change, the motivation to change. And so if you're coming in and what you're doing right now isn't working, but you're not quite sure treatment's going to work either. We have clinical staff that are trained to sort of work you up on the stages of change and get you to the point where you're totally bought into treatment.
Yeah, I mentioned too that people always say, well, you're just trading one drug for another. Is that really, I mean, what's the deal on that?
Yeah, so there's a lot of stigma that perpetuates that. My most common defense for that is, so you take, addiction is a disease, just like any other, like you say, we're medicated for all sorts of diseases right now. So you take someone who has diabetes, and they have to be on insulin every day. They go to their doctor, and their doctor's going to say, they're not going to say, you have to improve your diet, otherwise I'm not going to give you your insulin anymore.
Exactly.
Same is true. The medication that we provide is a treatment for a disease that person is dealing with. And it's life-saving medication backed by statistics and studies, and so we're giving them access to that medication so that they can work on stability through their social life. And the same way that the doctor's not going to say, you don't get your diet under control, I'm not going to be your pancreas.
Well, they stress it.
Yeah, they stress, and we do too. And we're constantly working with the patient through the medical side and the counseling side to develop skills and techniques to avoid the use and get to a point where maybe one day they could come off this medication.
Sure. Talk about the regulation, because this is a highly regulated system.
Yeah, we're regulated by the DEA, the Board of Pharmacy for the state of Virginia, DBHDS, the Department of Behavioral and Services, and then also those three major.
Whoever else has got a drug on the end of their name. Right.
Yeah. So the biggest ones are the state and the DEA. The state sort of regulates the clinical side, and DEA the medical side.
And go back to your staff as well. They all have to be trained and licensed, and
correct,
just like nurses and doctors and counselors and therapists. And
so we have a doctor on staff, nursing on staff, and then a clinical team as well that's been trained in addiction, and so.
Yeah.
My whole team is ready to provide every service that under the addiction umbrella, and then through the case management services, we're able to get them set up with mental health, or some have never had a primary care doctor, and so we're working on getting them to get medically stable in their own lives as well. So full range of services that we provide.
Been successful so far. You've got
people
are coming through the door.
Yeah, we're seeing.
That's something we don't really realize. We just go about our. If you're not in this situation, and you're thinking, well, why do we need that?
Right. Yeah. So. Slow growth, but we're seeing nothing but growth is what I've been saying. Patients are coming in, and right now it's just getting awareness that
it's one of those businesses you wish you were out of business.
Right. Yeah. And I worked in social services prior to joining Pinnacle 3 years ago, and I would always tell people my job is to work myself out of a job, and the same is true here. Is our job is to work ourselves out of a job.
Yeah.
And provide the best care that we can in order to do that.
So do government agencies get involved, like Department of Social Services, or is it just pretty much, because you don't go out and market, hey, here we are.
Right, yeah. No, so what my job has been prior to our opening, since about October of last year, has just been connecting with those community service organizations. So I've had meetings with DSS and with probation and parole and the key players in the community, to let them know what our referral process is, how to identify patients that qualify for services, and how to get them through the door, essentially.
Right. Well, it sounds like you got your work cut out for you.
Yeah.
But it's a good service, and I think our community has been waiting for it. We're trying to get a drug court going, and that'll be a part of this part of drug court. The way I understand it is they have to be treated.
Correct, yeah. And we've had conversations with the key players in those fields as well. So we're excited for the opportunity to be able to serve the community. Like you said, I know it's been a service that people have been waiting for, and I'm happy that we're finally opening and able to.
Well, what we'll do is we'll put the link to your website here in Front Royal. And people that maybe think they have somebody or want to refer somebody or just get some more information, because that's family gets involved in these things.
Correct. Yeah.
They really see things first before law enforcement gets involved, or before DSS or someone gets involved. That there's something going on, and that you can give them direction and help them on that.
Yeah, and we actually encourage patients to involve their family members if it's safe and they're willing to do that.
Right.
To involve them in treatment, because really,
So for
so long they've probably been battling this disease on their own, and so we want to give them a team of people that they know is in their corner, that is able to support them, to hopefully help them realize their goals in recovery.
Yeah, I guess boils down to it's more of a mental illness disease than a physical disease, isn't it?
Yeah.
Because somehow you got to you got to take it. So
Right.
your brain tells you it's okay, I guess.
Yes.
Yeah, it's like eating.
That's right. Yeah. We all have addictions.
We all that's it. We all have addictions. Some are more socially accepted than others.
Correct. Yeah.
And it goes into a lot of things: smoking, drinking, et cetera, et cetera.
Yeah.
And we just need to get our life on track. And so it's all about the choices you make.
So yeah, people they can go to our website, get more information. They can call the facility at 540-551-4056. They'll be connected with an admissions team as they'll be able to answer all the questions that they could ever possibly have.
Sure.
And to schedule intake. We do intakes on Tuesdays and Thursdays, and so they can either schedule the appointment or walk in.
Okay. Well, I've heard good things about Pinnacle. They're all over the place,
Yeah.
and so they have a good team set up. So it's great. Well, congratulations on your new venture, and we hope you're not here very long.
That's right. As long as we need to be.
As long as you need to be. I appreciate you. Thanks so much, Stephen.
Thank you.
Appreciate it.
Yep.